David, thank you. And with kids going back to school, there's been plenty for parents to worry about. But another virus is creating cause for concern. Zach Tawatari spoke to one parent whose child contracted it. Zach.
Xavier, the virus is called RSV, and as the numbers continue to rise, that mom is sharing her story to warn others.
I couldn't comprehend it. I was more astonished how quickly it happened.
That, says Columbus mother Breanna Cook, was how she felt when her 10-month-old baby Davon was put on life support, just days after testing positive for respiratory syncytial virus, also known as RSV.
Came down with the symptoms within 2 days, tested positive on a Friday, and then by Monday, he was barely able to breathe.
Breanna says Davon spent over a week in the ICU at Texas Children's West. Although doctors say RSV is usually a winter virus, it's been popping up more and more in infants specifically, part of a larger alarming trend with more kids testing positive, not just for RSV, but also COVID, and in some cases, RSV and COVID at the same time. Texas Children saying they've diagnosed more than 30 co-infections.
They were astonished of how bad it was.
It's created an even greater demand for pediatric ICU beds as the area continues to grapple with fewer ICU beds in general. According to Texas Children's, 30% of their pediatric ICU beds are occupied by children with RSV. Breanna is grateful she got in and the hospital was able to save her baby.
What if we were a day later?
As the Delta variant surges and more kids are exposed to RSV, she has a plea for everyone.
The masks are so necessary for everyone right now.
And Texas Children says they have more than 30 patients with COVID right now. And in recent days, COVID patients have taken up 10% of ICU beds, but they do have capacity. Xavier?
Zach Tawatari, such a scary time to be a parent. All right, thank you for that report.